Hello, my name is Katie Hobbins. I am the managing editor for MD+DI, and today I am here with Jim O'Connell, president of Frontline Care at Baxter International. Today we'll be speaking with him about the company's position in the diagnostic cardiology business, the team's dedication to advancing connected devices and technologies, and the company's history of acquisitions. So let's just go in to the first questions that I have for you. Obviously, it's been a little bit of time since Hillrom has been integrated into Baxter. Knowing that you had previously worked with Hillrom, how's that integration looking?
Yeah, so it's been now about 2 years and a quarter or so, I would say, since the original acquisition. As going through these things, and I've been part of big past acquisitions in the past, both previous to my employment with Hillrom and even helped integrated businesses into Hillrom. And it's gone very well so far overall. I mean, obviously, there's a lot of change management that goes into these processes. There's a lot of organizational changes that go into these processes and trying to figure out, okay, from both inside the organization environment from an IT perspective and all those things. And then most importantly, though, also really how we position ourselves out into the market and how we position ourselves as one Baxter overall, while still maintaining a lot of the value that we have with everything from our legacy Hillrom brand, even our Welch Allyn brand. So I would say, overall, I think things have gone very, very well. We're on this continuous journey. And one of the big changes that we made within the organization that went into place just about a year ago now is we actually organized our entire business as Baxter into much more verticalized business units, if you will. So Frontline Care now is part of what is called HST, Healthcare Systems and Technologies. It's one of the key segments within Baxter overall. The biggest plus to this is anytime we can verticalize the business, really what it means is greater accountability for the business internally, greater accountability for our customers as well in the way that we deal with our customers, and ensuring that we're really meeting the demands and doing business the way that our customers want to do business with us. So all in all, it's been a great journey so far, and we're continuing down that path.
So going a little bit into integrated technologies. Previously, I talked with you about the integration of smartphones and eye devices in the doctor's office. How is that looking in the cardiology space?
Everything that we do in frontline care and really throughout Baxter is about management information and connecting clinicians to patients in order to unlock better patient care. Really, if you think about it, as we think about cardiology in particular, we have a heavy focus of what is, in my opinion, considered connected care. That term gets thrown around a lot in healthcare of really what does it mean? Because it means a lot of different things. It means things inside the hospital where we're connecting, different devices, let's say into an electronic medical records, or maybe it's connecting nurses to patients or clinicians to clinicians or physicians or what have you in a hospital. For frontline care, it means a little bit more to me and to our business overall because we're really thinking about our care continuum across our business overall. So as we think about it, we're about a 50-50 split in business between inside the hospital and outside the hospital. So when we think about connected care from our perspective, we're thinking about, in the case of our ophthalmoscopes and otoscopes and digitizing the physical exam, connecting the patient to the caregiver so that information can be easily shared, or clinician to clinician if a specialist needs to be involved there too. But with regards to cardiology specifically, when I think about it, we have several different things that we're doing here. Number one, we made a strategic acquisition back in August of 2021 with BD Diagnostics. We've been in the cardiology space for many years, predating obviously Baxter, predating even the Hillrom acquisition with Welch Allyn, with things like resting ECG and stress test and short-term Holter and those types of devices. But what BD Diagnostics gave us is really a step forward into the ambulatory cardiac monitoring space. So what does that mean for me from a connected care perspective? Think about, it's always best to kind of tell a story. Think about a patient that presents, maybe they're wearing their smartwatch and something's been detected. Otherwise healthy, asymptomatic patient, but something has been detected by their watch, or maybe they did feel a short episode and they go in and see, let's say, a primary care physician. Up until now, that primary care physician may do a 10-second resting ECG utilizing one of our devices today. They can still do that, but you're only capturing 10-second snippets of that patient journey. Now, with the acquisition of BD+I, we can now actually place the CAM patch, Carnation Ambulatory Monitoring Patch is what it's called, on the patient's chest, register a patient into our system, into the portal. The patient will then wear this patch, capturing every heartbeat for up to 14 days, can either return the patch via mail or actually bring it back to their physician where it can be downloaded through a download station. Every piece of that data then will go through the cloud to one of our 3 independent diagnostic testing facilities, or what we call IDTFs, where trained technicians will then evaluate through different types of AI and multiple stages of human oversight every episode that that patient dealt with over that 14-day period of time. Comprehensive report will then be put together and then sent back to the prescribing physician for final interpretation. And this could be done on the primary care side of things. It could be done, obviously, major customers of ours are still cardiologists and EP physicians. But when we think about connecting care, that story kind of resonates the most with me because it's all about speeding up care, speeding up the diagnostic work that goes in. That patient otherwise, may be referred to a cardiologist and have to wait, a week or 2, or maybe even longer to get into the cardiologist's office and then start the diagnostic work. So we're really trying to make an impact to that patient care journey by providing connected devices, in this case, from the patient through the cloud to our facilities and then back to the referring physicians, which is really a great thing that we're making a big impact in.
Looking from that perspective, do you think that this is only going to go forward? Is connected care going to become something that is really championed within not only Baxter, because I believe it probably already is, but also other companies, institutions moving forward? Because that's just how the world's moving forward. Everything's connected.
Yeah, there's no question, but it poses a lot of challenges. I mean, if you think about it, we have an influx in and we'll speak to the US, but really it's a global thing. The patient population is aging overall. Lifespan of patients are increasing, which is a wonderful thing, but they're not increasing without challenges and health challenges. And then you have this other population that's getting more involved with their own health and continuum of care and education, if you will. So as we think about all of these different things that are out there in general between these, the challenge that runs into then is data. And there's not a challenge with data in and of itself or getting data. There's a challenge that we see in healthcare today with how do you manage this data? How do you make it actionable? Who's going to look at it? Because at the end of the day, also, there's not an overflow of nurses in this country. Or even across the globe, right? We saw that through COVID and the pandemic. This really put a strain on our healthcare system overall. So you have this perfect storm of more data than ever, more people focusing on this space. But I think one of the big challenges and one of the things that I'd love to talk to you about is how we're working through this is how do you take that data and fit it into the environment or the ecosystem of the physician or the hospital system.
I'd love to hear more about what you are doing to put that into practice.
Playing in the cardiology space for Baxter is not new. We've been in this space for many, many years. The addition of BD+I Diagnostics was a huge acquisition for us, but one other key one that we made in November of 2021 was the acquisition of Epiphany Healthcare. And the reason why that was so important for us is not necessarily because of the size of the business, or it's not necessarily about, people make acquisitions to grow, revenue and increase profitability and all those things. Those are important. Of course they are. But for this one, what was really important for us is if you look at the healthcare systems today, what you've seen dating back 10, 15 years, or really since the inception of electronic medical records, we saw a lot of consolidation in healthcare. We've seen big systems merging with big systems. Normally it was kind of in their own geographies. Now it's in the US, it's across the country. It doesn't matter, right? Big systems organizing with others. We see big clinics and specialty offices being acquired by private equity firms and alike. And what happens there is, it's very hard to then drive standardization, if you will, to have people on consistent systems. So what the acquisition of Epiphany enabled us to do, Epiphany is really a leading provider in what I would consider vendor neutral. We don't necessarily carry the devices that are in a health system today. So we could take a health system that might have, 20 or 30 different vendors, 50 different vendors that they're trying to consolidate information. Epiphany gives us the opportunity with our cardio server solution to take all of that information, to aggregate it via the cloud, which is really important. But it's a leading provider in cloud-hosted ECG management solution is what we call it. We decrease the burden from an IT footprint perspective. And being through the cloud now, we have the opportunity to take all of these disparate vendors and solutions and data and aggregate them, not just from a hospital perspective, but also from a clinic perspective, where historically that's been a big challenge. Clinics have never necessarily been able to share the information as cleanly and articulately as what's going on inside the hospital. So we're trying to meet customers with where they're at as they continue to grow, as they continue to expand, providing solutions that say, obviously, do we have an interest in organizing around our devices being used and making the biggest impact in healthcare we can? Of course we do. But it's also important for us to provide solutions and software-based capabilities that meet customers where they are and saying, listen, we understand you have multiple vendors. We understand you have multiple footprints across the United States. We could take all of this, though, and really fit this into the way that you're doing business today and really try to make a positive impact there.
You touched on something that I did want to expand upon a little bit, which is the cloud and how all of this information is coming together and is accessible to so many. But how do we make sure that it is safe, it is protected? Right. What are the cybersecurity measures that are being put in place to make sure that patient data is staying in the right place and not getting into nefarious hands?
It's on the forefront of our minds. We have made probably, I think, about a 3 or 4-fold investment, greater investment year over year in trying to make sure that we're tackling this and staying up with the latest and greatest requirements that exist out there. Because without that, it's impossible to not just deliver solutions, but deliver them in a secure way as we think about that. We have a very robust team within Baxter from a central cybersecurity aspect that then works with the subject matter expertise within different divisions so that we kind of have the best of both worlds there, right? We're constantly focused on keeping up with the latest codes and standards that we must comply to. The FDA has put much more disciplined rigor around new product development and FDA clearances on products that deal with whether they be cloud-based solutions or any really connected type of solution. That's on the forefront of our minds every day.
For a lot of companies that are creating the next wave of technology, I think a big balancing act tends to be with the cybersecurity, making sure it's very secure and having those practices in place, but still making it available and ready to use for the front lines of care, the human factors that go into that, and how do you balance that balancing act?
VOC, or voice of customer, is obviously at the forefront of everything that we do. And I think it is probably, in a lot of the folks that you would talk to in the industry, right? Sometimes it's missed in some cases. We've seen products, not necessarily within Baxter, but products in the market that have kind of missed the mark on things because it didn't take all key stakeholders into account. Where historically it's been the clinicians that utilize products, right, that touch them, that deal with them every day have been key folks that play a part from a VOC perspective. More and more, though, it's IT for us now. We've got to make sure that we are getting the right inputs from our customer base that say, hey, you're going to need to meet these requirements for our health system in order to do business. And we're constantly focused on that as well. So it is a balancing act. We want to make sure that we're delivering solutions that are meaningful to patient care and patient outcomes, but ensuring that we are not compromising in any way these situations. Unfortunately, there are a lot of bad actors out there, and we need to make sure that we're doing everything that we can to minimize those opportunities.
Kind of going back a little bit, you discussed an example of physician or healthcare practitioner to patient in integrated care. Could you talk to physician or physician to practitioner development in cardiology diagnostic care?
Sometimes as we think about patient flow, and we've seen this with, let's say, our RetinaView diabetic retinopathy screening. One thing that we're keenly focused on, and we believe, and based on our voice of customer as well, is we want to make sure that care is taking place where it needs to take place. We have 4 main pillars of strategy, if you will, within frontline care. One of them is intelligent diagnostics. Cardiology is one, patient monitoring, connected patient monitoring, intelligent diagnostics, and our therapies business with our respiratory health business. The reason why I bring that up is because as we think about things like this, we are all about what frontline care is, right? Frontline care is delivering care on the front line. We're seeing care shift. We're seeing it shift from everything from specialty offices to lower acuity settings, whether it be primary care or retail space. We see expansions of players like CVS and Walgreens, acquiring physician groups or creating greater capabilities, whether they're attached brick and mortars or within their own pharmacies. And you can't do that without creating capabilities of connecting lower acuity settings to higher acuity settings. And so going back to my reference from earlier, if we think about that, there's great value to the healthcare ecosystem as a whole if we can help our customers parse out where patients need to go to be treated. And a lot of that comes in with the connectivity between physician to physician. As I mentioned several years ago, before BD Diagnostics was part of our family of solutions, that patient would go from primary care maybe to a cardiologist. Well, that screening might have taken place. It might have been an increased cost to that patient, increased time for that cardiologist to only find out there was nothing wrong with that patient. We're all about also trying to help connect clinicians together within a health system and say, hey, listen, we can do some of this diagnostic work or intelligent diagnostic work at lower acuity settings to make sure that our specialty offices are freed up to really do the things that they're meant to be there to do. And with all of that comes in connecting physician to physician as well, and creating kind of this flow of patient care throughout a healthcare system.
And how does AI fit in?
We are actively involved with AI projects, both internal communication projects within our own business, right? How do we operate more efficiently through the use of AI? And then how can we better provide services and solutions to our customers that fit into that? We're going to be in an interesting place here over the next several years to see exactly how the FDA, how CMS, how does this impact reimbursement? What's the impact of this overall? But one of the things that to give an example of some of our focus there, we have publicly announced a development partnership with Digital Diagnostics from a diabetic retinopathy screening perspective. This is something that's recognized and reimbursed utilization of AI in this procedure. So right now we have a very strong portfolio of solutions where we're helping to impact the capability of saving diabetic patients from losing sight through our RetinaView and RetinaView Network solution. And soon we'll be able to offer point of care or immediate feedback through the utilization of AI on our diabetic retinopathy screening solutions. And really, AI has actually been part of healthcare for frankly a long time. I mean, there's a lot of software that companies have used for a long time to maybe not from a final diagnostic step, but in a triaging of information process. How do you take data points over long periods of time and truncate them and look at those things faster? AI may not be used as heavily in final diagnostic work, but it has been in use for a long time to help sort through data to get to that diagnostic work that needs to take place faster.
Talking from the patient perspective, how do we make sure that the use of these devices are equitable?
Yeah, I think it's a great point. I mean, because you can develop all sorts of technologies and solutions that if they're cost prohibitive to our communities, then really what are they worth at the end of the day? I think those are some of the benefits, though, frankly, of AI and what some of these opportunities. And this is, as we think about frontline care and some of the things that I said about earlier, this is where we're keenly focused, right? We're keenly focused on trying to impact patient care where it's being delivered at the time that it's being delivered. And if we could do that, I think there's a tremendous amount of ripple effect of value to even patients. If you think about the instance, and not to share another story, but I will, because I think it makes sense. If we think about things like diabetic retinopathy screening, right? And I speak about these things because these are the things that I know the most and most intimately. Historically, a patient could not go and have the screening done at their point of care. They would actually go to primary care and then have to go to a specialty office and have another, whether it be a copay or some other financial burden that they might accept. Now, putting these devices in the hands, we can make an immediate impact just by getting more things done at the time of care. So I think there's one big benefit there. I think AI will help ultimately, speed up efficiencies to where things can be moving faster through the healthcare ecosystem overall, which will lower cost of care and the burden of care of delivering. And then also, there are great opportunities for greater community outreach with some of these things as well. We've seen some of our mobile customers make tremendous impacts in diabetic retinopathy screening by doing community outreach programs and being able to do hundreds of screenings in a day, as opposed to maybe 3 or 4 by patients that just happen to walk into their physician office. There's great things out there today, and I think there's more to come.
So what's next for Baxter, for frontline care? What's going on?
I think I shared with you a little bit about our 4 key areas of focus if we think about them, right? If we think about intelligent diagnostics, staying keenly focused on how we could reduce cost of care and meet more patients where they are through immediate diagnostic and intelligent diagnostic technologies. That's one key thing there. Cardiology, which we spent a lot of time talking today, key area of focus for us. We think there's a tremendous opportunity for us to impact the market and patients there as we think about this aging patient population and really being able to supply technologies and solutions that really hit on all areas of diagnostic work as it has to do with cardiology. And we're looking at greater expansion and new product development there. Connected patient monitoring. We've historically done a great job connecting monitoring inside the hospital and even outside the hospital. But how do we bring more focus on hypertension prevention programs into our primary care space? How do we connect devices better in the outside the hospital? How do we gain deeper participation in things like home care and remote patient monitoring? We're actively, obviously, very interested in that. And then, of course, our respiratory health business, where we're really trying to impact patient care when it comes to easing the work of breathing in the home. We're staying very disciplined to those key areas of focus. I wish I could share with you every bit of exciting things that we have working behind the scenes, but of course we'll wait till those things hit the market. But we have a significant investment in research and development going on right now. We have exciting product solutions that will be coming to the market. We just gained FDA clearance on our next generation Vest APX product for our respiratory health portfolio. And I'm very confident when I say that there will be many, many more to come over the next 18 months.
I want to thank Jim O'Connell for speaking with MD+DI today. Thank you, Jim.
Thank you, Katie. It's been a pleasure, and I look forward to speaking with you again real soon.